It began, as disasters often do, with something ordinary. Just another July day in Chicago, humid, slow, and heavy with heat. The kind of heat that clings to your skin, seeps into your lungs, and settles like a weight on your chest. People fanned themselves on porches, kids ran through hydrants in the street, and the city went about its business. After all, it was summer. This was nothing new, but beneath the surface, something deadly was building. On July 13, 1995, the temperature soared past 100 Fahrenheit. The humidity pushed the heat index to 126, and it stayed there, not for hours, but for days. At night, the heat didn't let up. The concrete, the bricks, the very bones of the city held it in, turning homes into ovens. Air conditioners broke down, power grids strained, and in the neighborhoods where air conditioning wasn't an option, where fans were a luxury and open windows were a risk, the real danger began. People started dying, quietly, alone, and out of sight. The city wouldn't know how bad it was until it was too late. Not until morgues overflowed. Not until they had to bring in refrigerated trucks to store the dead. Not until reporters asked why so many elderly black residents were dying behind locked doors in some of the poorest zip codes in the city. In total, 739 people died. It remains one of the deadliest urban disasters in modern U.S. history. And yet, most people have never heard of it. No monuments, no day of remembrance, just silence, as if these deaths were forgettable, as if they were expected. But they weren't. This wasn't a natural disaster. It was a social failure, engineered over decades, reinforced by poverty, neglect, racism, and indifference. This is the story of the Chicago heatwave, the week the city cooked and left hundreds to die alone in the dark. To understand why 739 people died in a single week, you have to understand the city they lived in. Chicago in the 1990s wasn't just a city. It was a map of invisible lines. Lines drawn by decades of redlining, urban renewal, and white flight. Neighborhoods like Inglewood, North Lawndale, and Austin, once thriving, had been hollowed out by policy, poverty, and neglect. What was left were crumbling buildings, failing infrastructure, and tens of thousands of elderly residents living alone. Most of the victims of the heat wave weren't just old. They were poor, they were black, and they were invisible. While wealthy areas on the north side had leafy streets, central air, and easy access to hospitals, the south and west sides had something else: isolation. Many seniors there were afraid to leave their homes, afraid to open a window, afraid to let their guard down, because crime rates were high and trust in police was low. In some buildings, the windows were sealed shut. In others, fans sat unused for fear of running up the electric bill. For many, it was safer to sweat in silence than risk violence on the street. And this wasn't an accident. City budgets had been cut for years. Social services were gutted. Programs that once checked in on the elderly, defunded. The very systems meant to protect the most vulnerable had been dismantled long before the heat wave hit. So when the temperature spiked, it didn't just stress the body, it exposed everything. The design of the neighborhoods, the absence of emergency infrastructure, the long, slow abandonment of an entire class of people by the very city they lived in. And it wasn't just about buildings or broken policies. It was also about how society viewed the people who lived in those zip codes. In official reports, victims were described as frail, already ill, or marginal. Words that shifted blame onto the dead, as if the heat didn't kill them, age did, or poverty, or their own bad luck. But the truth is harsher. These people didn't die because it got hot. They died because no one cared enough to keep them alive. Thursday, July 13th. Chicago woke up already sweating. By midday, the heat index had climbed to 119 degrees Fahrenheit. The city shimmered in the haze. Sidewalks burned through rubber soles. Metal door handles could scald skin. But the worst was yet to come. That night, the temperature didn't drop. The city's concrete and brick infrastructure, its buildings, streets, and walls had absorbed so much heat during the day that it radiated back like an open oven. In some apartments, especially in the west and south sides, indoor temperatures remained above 100 degrees Fahrenheit all night long. By Friday, July 14th, the system was already straining. Emergency rooms were flooded with people suffering from heat exhaustion, dehydration, heat stroke, but many didn't make it that far. The elderly, especially those living alone, began dying quietly in their homes. Some sat in recliners, others lay in bed. No struggle, no help, just silence. Saturday, July 15th. The morgue was full. Bodies were arriving faster than they could be processed. The Cook County Medical Examiner had to request refrigerated trucks to store the overflow. One reporter later described it as a war zone without a war. The streets remained eerily quiet. Unlike a flood or a fire, heat doesn't destroy buildings. It doesn't make noise. But behind thousands of closed doors, people were suffocating. Some had fans, but they feared using them. One woman turned hers off because her last electric bill was too high. She was found 3 days later. Others didn't trust opening their windows. In high-crime neighborhoods, an open window could mean a break-in, or worse. The heat was terrifying, but for many, it wasn't as terrifying as the outside world. By Sunday, July 16th, the media began to notice, but even then, there was confusion. Mayor Richard Daley downplayed the situation, calling death estimates unconfirmed. He argued that it's hot, people die in the summer. But inside hospitals and apartment buildings, the numbers kept rising. By Monday and Tuesday, the bodies were piling up faster than death certificates could be issued. Hundreds more were being found, some after days of decomposition. The smell led neighbors to call police. In many cases, there were no relatives to notify, no funerals, no headlines. By the time the heat finally broke on July 20th, the official toll stood at 739 dead. But the number doesn't tell the whole story. Because what killed these people wasn't just heat. It was fear, isolation, poverty, and a system that watched them die from just down the block. As the death toll climbed, city officials had a choice. They could acknowledge what was happening, activate emergency systems, and treat the crisis like the mass casualty event it was. Or they could stall. Mayor Richard Daley chose the second. During a press conference as bodies were being stored in trucks behind the morgue, Daley dismissed concerns, saying, "It's hot. People die in the summer. Let's not get carried away." When asked if the city had a plan to deal with heat emergencies, his team insisted everything was under control. But on the ground, it was chaos. Cooling centers, designated air-conditioned shelters for vulnerable residents, weren't opened until days into the disaster. Many people didn't even know they existed. There was no citywide campaign to check on the elderly, no door-to-door visits, no coordinated outreach in the most at-risk neighborhoods. And when 911 calls flooded in, thousands of them, dispatchers were overwhelmed. Paramedics were stretched beyond capacity. In some cases, help arrived too late. In others, it didn't arrive at all. But the failure wasn't just logistical. It was ideological. The victims were, for the most part, poor, black, elderly, and isolated. And to the system, their deaths weren't surprising. They were predictable, acceptable even. A quiet subtext ran beneath media reports and government statements. These people were already fragile. They probably would have died anyway. But that wasn't true. Many victims had no pre-existing conditions. They simply overheated, slowly, alone. The United States had no precedent for this scale of heat-related deaths in an urban setting. But instead of learning from it in real time, the city of Chicago tried to pretend it wasn't happening. Why? Because owning the disaster meant admitting that long-standing policies had failed. Policies that cut funding to public health programs, that left poor neighborhoods without investment, that treated aging populations as burdens, not responsibilities. The heat didn't discriminate, but the infrastructure did, the emergency response did, the indifference did. This wasn't about weather, it was about worth, who we protect, and who we let die quietly behind closed doors. Once the numbers became undeniable, silence gave way to outrage. 739 dead, most of them elderly, most of them poor, most of them found too late. At first, the media treated the story like a weather report, a freak occurrence, a tragic coincidence. But as the days passed and the refrigerated trucks lined up outside the morgue, the tone began to shift. Journalists started asking harder questions. Why weren't cooling centers opened earlier? Why wasn't there a heat emergency plan in place? Why were the deaths concentrated in Black and Latino neighborhoods? And why was the city so hesitant to call it what it was, a disaster? What followed was one of the most uncomfortable reckonings in modern urban history. For weeks, Chicago's failure dominated headlines. Editorials demanded resignations. Community leaders accused the city of negligence, if not outright abandonment. But even then, something strange happened. The story faded. There were no candlelight vigils, no national day of mourning, no memorials. It was as if the victims had died twice, first from heat, then from erasure. Yet in academic circles, the legacy endured. Sociologist Eric Kleinenberg published a landmark study, Heatwave, a social autopsy of disaster in Chicago. It wasn't just a book, it was an indictment. Kleinenberg's work laid bare the systems that failed, the city's disinvestment in community infrastructure, the decline of social networks, the racial geography of risk. He showed how vulnerability wasn't random, it was patterned, predictable, and preventable. Lawsuits were filed, some families won small settlements. The city eventually updated its emergency response protocols, adding heat advisories, improving outreach, and expanding public health surveillance. But even as policy shifted, memory didn't. There's still no monument for the victims, no annual recognition. Many of the names never made the papers. Some were buried in unmarked graves. Others had no one left to claim them. And in the years since, heat waves have only become more frequent, more dangerous. The climate is changing, but the question remains, are we? What Chicago lived through in 1995 wasn't an anomaly. It was a preview, a warning whispered through concrete walls and broken fans. It told us that disasters don't just happen in storms or fires. Sometimes they come quietly, on the hottest night of the year, and no one comes to help. What happened in Chicago in 1995 wasn't just a tragedy, it was a mirror. A mirror held up to every city that ignores its most vulnerable. To every system that sees poor, elderly, and isolated lives as footnotes. To every society that only reacts after the damage is done. Since then, heat waves have become more frequent, more intense. Cities like Phoenix, Houston, and New York now face summers that push infrastructure and people to the brink. We know more now. We have better forecasting, more data, more warnings. But here's the real question. Have we actually changed? In neighborhoods across America, millions still live without reliable air conditioning. Millions of seniors still live alone. And when the next blackout comes, when the next week-long heat dome settles over a city, who will check on them? We have the tools. We have the science. What we're missing is the will. The Chicago heat wave wasn't a natural disaster. It was a social autopsy, a slow-motion catastrophe dissected in real time. It showed us how inequality can kill without lifting a finger, how bureaucracy can outpace compassion, how some lives, quiet, elderly, poor, can vanish without headlines, without mourning, without memory. But we don't have to forget. We can remember them by refusing to repeat the pattern. So the next time the forecast says 100 degrees, ask yourself, is there someone down the street with no fan, no family, no one who'll knock on their door? Maybe that someone is closer than you think. And maybe, just maybe, we stop the next disaster, not with a rescue, but with a visit. If this story moved you, share it, tell someone, comment below. Because forgetting is how it happens again.